Well, thank you all very much for being here. We stand here today with just really one simple message, and that is that Congress needs to help us overcome state Republican obstruction and provide an alternative pathway to access health care for about 6 million Americans who've been denied access to Medicaid. Can you hear okay back there? All right, I think we're good. We've got what we think is a homegrown solution, a new approach that has not been advanced previously to address the needs of our most vulnerable citizens by empowering our local governments to cover their residents and protect their health. The Cover Now Act is a pragmatic approach that would allow these local governments to contract directly with the Centers for Medicare and Medicaid Services, CMS as we know it here, to protect Medicaid, to provide Medicaid to their residents through demonstration projects. Our bill would provide local governments the same funding that was made available to state governments around the country, but which 13 states chose not to take advantage of. That means 100% federal funding for the first 3 years, tapering down to 90% over 7. The 42 sponsors of this approach represent almost every Democrat in a non-expansion state, and we will be filing our bill shortly this morning. There are millions, hundreds of millions of people, in fact, who benefited from the Affordable Care Act. But what we are about today is ending the discrimination against the many who did not benefit. They are the economically disadvantaged neighbors that live in our states where Republicans' ideological retrenchment and indifference interfered over equity and public health. I know about this personally from open enrollment events that I've done in Texas. I can just tell you, to have a family come up and see the disbelief and the pain in their faces when they are told that they are too poor to get into the marketplace you really just can't explain it to them. I have, especially when they know that their neighbors who are wealthier than they are getting help from the federal government. I think of Gloria, who is a Texas tough mom who struggles to keep herself healthy and who has 2 children with significant disabilities. Although her kids have been covered with Medicaid, she is only able to work part-time in order to try to take care of them. She has chronic asthma, and the last time she had a severe attack, it took over a year for her to pay off her emergency room bill that she had to turn to at the last minute to save her life, but she had no insurance to cover it. I think of Vanessa, who called from Kyle. She recently aged out of her parents' insurance. With a monthly income of $750, she's too poor for Medicaid, too poor for marketplace assistance, and she doesn't qualify for Texas Medicaid, a very stingy program. Nija is someone who received Medicaid as a child, and she benefited from that with some mental health issues and medication. But now she's aged out at 18 of the program, and she's been uninsured and unable to get the care that she needs. In Texas, we have the disgraceful distinction of having more uninsured citizens, more uninsured children than any state in this entire country. Though, and I think these women that I mentioned that we've had contact with, they are representative of over 2 million Texans estimated to be able to gain health and security through Medicaid expansion. People of color make up about 60% of the coverage gap. And over 2/3 of the women who are in their reproductive time in life are included in this coverage gap. And we know that African American women, this has been a real issue in Texas, 2.5 times more likely to die from pregnancy than a white woman. One of the most important ways to close the racial inequity gap is to close the Medicaid gap. The Cover Now Act is certainly not the only way to solve this problem. I'm for any approach that will get us the most coverage the soonest. But the one way that will not work is for us to leave here again and do nothing for those who suffered a decade without coverage. nor can we settle for one of these, the states will see the light approach with some kind of short-term coverage stopgap that hopes that someday, after a couple years, we'll get there. I think we saw what local leaders can do during this pandemic. They stepped up in our state and in so many of the other states when the governors failed, when the president failed, and helped us get through the pandemic. We know that local governments also include in urban areas a large number of the uninsured. In Texas, we're just about to hear from Houston, but it represents a fourth of all the people who could benefit from this. With Houston, San Antonio, and Dallas, we get half of the uninsured in Texas. The Cover Now Act enables willing local leaders to accept directly federal resources to achieve both the public health and the financial benefits of Medicaid. For many of our most disadvantaged citizens, what this means is not just being enrolled in a government program, it means you get access to a family physician, that you get access to the medications you need and other essential service. It empowers our local officials to assure that the obstructionists at the top don't harm those who are at risk at the bottom. So today we want to close the gap. We're unwilling to walk away without a solution and leave the disadvantaged empty-handed once again. They've been waiting for a decade. It's time to cover them now. One of our colleagues who serves on the Health Subcommittee of the Energy and Commerce Committee, a dynamic member from Houston who will be considering this legislation, is Lizzie Fletcher. Lizzie, would you add a word or two?
Well, thank you so much, Lloyd, for that wonderful explanation of the Cover Now Act. And I want to thank you so much for hosting this conference and for being a champion for healthcare, for being a champion for healthcare for those who can't access it. On Monday of this week, we stood on the House steps and recognized the more than 600,000 American lives that have been lost to this pandemic. A pandemic that highlighted the crucial need for healthcare and further exposed the vulnerabilities already existing in our healthcare system. And in our home state of Texas, we are in a healthcare crisis, one that preceded the pandemic, but that has been exacerbated in the pandemic. And too many families are worried about whether they can afford the healthcare they know that they need. This is felt acutely in my community in Houston. In Harris County, my district is located. It is the largest county in the state. It's a county with a population larger than 25 states. More than 1 in 3 people under the age of 65 does not have access to health insurance. There is a solution that's on the table to help close this gap, and that's expanding Medicaid. That's why I'm so proud that my legislation, the Expand Medicaid Now Act, was signed into law as part of the American Rescue Plan. And that bill significantly increases the financial incentives for holdout states like Texas to expand Medicaid. Expanding Medicaid is popular. A recent poll by the Episcopal Health Foundation in Houston found that 69% of Texans support expanding Medicare. And it has Medicaid. And it has bipartisan support in our state. One Medicaid expansion bill passed out of the Texas State House, but unfortunately, our Senate didn't take it up. And that's a disgrace. Not only because at some point in every person's life they will need access to health care, but because we're already paying for it. This is a problem we must tackle head on. We can do that, but we need all the options on the table. And that is why I am so proud to co-sponsor the Cover Now Act to empower local governments like ours in Houston and Harris County to cover our community's health care through Medicaid expansion. In our county, more than 200,000 people are estimated to benefit from Medicaid expansion. Yet we're relying on our state government to decide how we can provide our community with health care. Time and again, we cannot rely on Austin to do this. And as my colleague, Mr. Doggett, has explained, there are so many people who stand to benefit in the cities in Texas alone, nearly 1 million people. The Cover Now Act would allow local leaders to take action and to accept the federal resources available to them for Medicaid expansion to help keep our communities healthy. And that's something that we all know must be our priority. So I want to thank you, Congressman Doggett, for your leadership on this issue, and I look forward. I agree with you that we need to have all options on the table, and that I too am for anything that will help get people covered. And so I'm excited to join you this morning and excited to introduce this bill with you today. Thank you.
Thank you so much, Lizzie. You know, we couldn't pass the Cover Now Act but for what happened in Georgia. And while much of the focus has been on the Senate appropriately, we had another great victory when Carolyn Bourdeaux was elected in Georgia. She brings experience as the director of the Georgia Senate Budget and Evaluation Office, responsible for the budgetary matters in Georgia, and she understands how important it is to state finances as well as to the finances of individuals to have health care coverage for all. Carolyn, thank you.
Thank you, Congressman Doggett, for your leadership on this issue, and thanks to all of my colleagues who are co-sponsoring this very, very important piece of legislation. I'm Carolyn Bourdeaux. I represent Georgia's 7th Congressional District. There are 12 states that have yet to expand Medicaid, and Georgia is one of them. Congressman Doggett talked about how Texas has the highest number of uninsured in the country. Georgia is second. Estimates put the number of people who would receive health care coverage as a result of Medicaid expansion at nearly 500,000, and the state would draw down between $2.2 to $3 billion a year. Still, the governor has refused to act. When the American Rescue Plan was signed into law in March, one of the reasons I supported this bill was that it gave states that had not yet expanded Medicaid, including Georgia, a second bite at the apple, with a higher federal matching rate for Medicaid expenses. And still, the governor and the General Assembly refuse to act. We talk about Medicaid expansion in the abstract, but there's a deep and profound human cost. A few years ago, in my district, a man showed up at an outpatient clinic crippled by excruciating pain from advanced stage rheumatoid arthritis. He was a day laborer, so was too poor to get a subsidy for insurance on the exchange. And he had come because the pain was so great he could no longer work at all. The doctors had to tell him that they were so sorry. If he had come to see them a few years before, they would give him anti-inflammatory drugs that could have protected his joints, and he would still be working today. But now the disease had destroyed his joints, and there was nothing they could do but to give him painkillers to relieve his suffering. The irony is that now he is eligible for disability, and now he is eligible for Medicaid. As you may know, I'm a budget person, and I can tell you that what we are doing is fiscally wrong. It's more expensive to pay for disability than it would have been to pay for those anti-inflammatory drugs. I've written multiple times about how states would save money in their budgets by expanding Medicaid and reducing the need for the patchwork quilt of programs that are in place to try to patch the holes in our broken healthcare system. We are also all paying for the uncompensated care and our own rising premiums. So it's fiscally irresponsible, but it's also morally wrong that we hang our working people out to dry in this way. Today, we are introducing legislation that would provide an alternative for counties and local governments who want to expand. The Cover Now Act empowers counties to work directly with the Centers for Medicare and Medicaid Services to offer health insurance coverage for those who would have been eligible if our states had made the decision to expand Medicaid. In my district, for example, if the Cover Act were to become law, Gwinnett and Forsyth counties could cover those eligible, even as the state refuses to act. I know many of us are sick at heart because our states have not expanded Medicaid, because we know the deep human cost of this choice. It's time to expand Medicaid, and if our states won't act, we need to let our local governments act. The Cover Now Act does just that. Thank you very much.
Thank you, Kathy. I was distracted a moment during your insightful comments because I'm just advised that the Supreme Court has tossed out the challenge to the Affordable Care Act, which is a wonderful victory today on standing grounds. But continuing on the Cover Now Act with our Texas focus also, Sylvia Garcia has been there in the Texas Senate when efforts were made to try to get expansion in Texas. She has insight into this problem also from working as a county official, and I'm glad to have her join as an active early supporter of this effort to Cover Now. Sylvia?
so much, and because I'm smiling with the Supreme Court decision, I'm taking the mask off so you can see the smile. That is absolutely good news, and it certainly is good news that we will be filing this bill today. I want to thank Representative Doggett and all the representatives that are here with us today that are co-sponsors. You know, it's just unacceptable that Texas has not joined in with so many other states in taking advantage of Medicaid expansion. This is an issue, as noted by Representative Doggett, that I have followed for many, many years, not just as an elected official, but as a social worker and even a kid growing up without health care. You know, we need more access. When Representative Fletcher talked about Harris County, which is our county, being about 1/3 of the whole thing, well, my district is about 1/3 of the 1/3. We have the highest uninsured rate in my district than any other district in Harris County. 1/3 of the people in my district do not have health care coverage. And they painfully recognized how important having health care coverage is when we went through this pandemic. So if ever we needed expansion, we needed it now. And I think this bill provides a unique opportunity for counties like mine that were willing to step up, because I've already had the county judge, the county commissioners talk to me about this. And when I was commissioner, we put a pencil to it. If we got expansion, what would that save us? It would save us a penny out of the taxes that we allocate from Harris County for our indigent healthcare system, because we have one of the largest in the country. It would save us a penny that we could either give back in savings to the taxpayers, or a penny that we could use for other healthcare needs in our county. So this is a very, very excellent option, and it's something that should be available, and should be available now. So I am really pleased to be here in support and welcome any opportunity to work with all these members and the rest of our colleagues across the aisle to make sure they know that this just makes sense. As was said by the previous speaker, you know, we save dollars by doing this. I know we would in Harris County, and I want to work on it. So thank you, Representative Doggett, for bringing this bill together.
Thank you so much, Representative Garcia. And Representative Cuellar was here to speak, but had a delegation come up. He has an area of South Texas that covers so many hospitals that have been closing down that can benefit from this, and so many economically disadvantaged people. But lest this be an all Texas event, we're very fortunate to have Kathy Manning from North Carolina. She serves on the Education and Labor Committee, where she fights for the rights of workers and students. She is well aware of the challenges that not having insurance for many people in North Carolina have presented to the state. So Kathy, thank you very much for joining us.
Thank you so much, Congressman Doggett. Good morning. I'm Congresswoman Kathy Manning. I represent North Carolina's 6th Congressional District, and I am so pleased to be here today to discuss the Cover Now Act. An estimated 4.3 million Americans are currently without health insurance in states that refuse federal funds to expand Medicaid under the Affordable Care Act. This bill would allow CMS to contract directly with counties to provide coverage to those who would not have qualified under Medicaid, who would have qualified under Medicaid had their states not blocked the expansion of coverage. Disappointingly, my home state of North Carolina is among 13 states that have failed to expand Medicaid. This leaves more than 500,000 North Carolinians uninsured due to bad faith efforts to stop the expansion of Medicaid by our state's Republican-controlled General Assembly. The decision to obstruct healthcare access has hurt millions of Americans and disproportionately affected communities of color. As the COVID-19 pandemic highlighted during the past 18 months, communities of color suffer from significant disparities in healthcare, including lack of access and lack of affordability. The blockage of Medicaid expansion in certain states has widened these racial and ethnic disparities. To help close that gap, we must allow counties to provide expanded Medicaid coverage so that eligible citizens can receive the care they need. This bill is essential for states like North Carolina. Despite the malice displayed by Republican leaders in my home state, this issue doesn't have to be a partisan one. Several states with Republican-led legislatures, including Arkansas and Kentucky, have adopted and implemented Medicaid expansion. The broad bipartisan support for Medicaid expansion highlights the necessity of this program and the urgency to get this bill passed so we can deliver relief for people in need. I'm proud to support this legislation because in my home state alone, it will mean more than 500,000 North Carolinians will finally have access to health care coverage, and millions more will get coverage nationwide. I urge my colleagues to join me in supporting this life-saving legislation. Thank you.
Thank you so much, Kathy. Coming directly to Congress from county government, which could administer this kind of program, and who's been such a dynamic member of our Congress and an advocate for the disadvantaged from El Paso, Veronica Escobar.
Thank you, Representative Doggett. Thank you for your leadership on this issue and for bringing together such fantastic women to surround you as we unveil the Cover Now Act. My name is Veronica Escobar. I represent El Paso, Texas, where 1/4 of my residents do not have any health insurance coverage at all. And that is pretty similar along the Texas-Mexico border. And make no mistake about it, the decision by state leaders like Greg Abbott, like Ken Paxton, not only to not expand access to health care, but also to fight health care, and I'm so delighted by the news that they have been repudiated by the Supreme Court, but their decision not to expand access is a decision to keep people in poverty. We know it, and they know it. Lack of access to health care, which is a human right, lack of access to health care keeps people in poverty. As Representative Doggett mentioned, I had the incredible privilege in serving in county government in El Paso for almost a dozen years. I served as county judge in El Paso. That bird is so delighted by that Supreme Court decision. Sylvia and I were just talking about how the birds are chirping a little bit more loudly after Lloyd's announcement. But I served as county judge for 2 terms. County judge essentially is the leader of county government. Contrary to what Greg Abbott and Ken Paxton may hope, sick people don't go away. Sick people go to the ER. And they generally go to their public hospital emergency room. In Texas, who funds emergency rooms for public hospitals? Local taxpayers do. In economically disadvantaged communities like mine, those who can afford it least are having to shoulder the greatest burden because of not just the dereliction of duty by Texas' highest leaders in the state, but also by their desire to keep people mired in poverty. The County of El Paso, when I was in county government, we actually worked to expand access to health care by building world-class primary health care clinics. We kept seeing our ER costs going up, year in and year out. The vast majority of those visiting the ER were people without access to health insurance. And when they visit the emergency room, they generally were much sicker in that moment than they could have been or would have been had they had access to primary health care. And when you ask them, why didn't you see a primary health care physician from the get-go? The answer is universal. I don't have health insurance. I want to close by telling you a quick story of how profoundly clear all of this was for me during the pandemic. I serve on the House Armed Services Committee, and we were having a hearing about the military's response to COVID and how it was addressing COVID cases among military personnel. I'm near the end of the dais, and so I was one of the last ones as a
freshmen to ask questions about the issue. And my question was about the data that the DoD was collecting. And I asked them, are you collecting demographic data on who's getting sick and how sick they're getting? And they said, yes, we are, of course. Great. Can you tell me, does the military data on which populations are most vulnerable, does it mirror what we're seeing in the civilian world? In other words, as we were seeing African American and Latino populations getting sicker and dying at faster rates because of vulnerabilities associated with lack of access to health care, were we seeing that same pattern emerge in the data and the demographics for those in the military? And the response was clear, candid, and proved to me that healthcare makes a difference. The response was no, because our military personnel have access to healthcare. The lack of access to healthcare during COVID killed people. It killed people. It decimated their finances. It drove people deeper into poverty. And we're not talking about poverty that only impacts the immediate family at that given time. I'm talking about generational poverty. And on the border, it is most chronic. Thank you, Representative Doggett, for leading us in this effort. It is long past time we circumvent people like Greg Abbott and Ken Paxton. We've got to stop hoping that they will open their hearts and get off the culture war train, and we've got to take care of our people, and that means governing. Thank you.
Amen. Thank you very much. You know, in an earlier time, as Texas was forming, Davy Crockett was not the only one who went from Tennessee to Texas. Some of those cabins had GTT, gone to Texas, just written on them because everybody knew where they were coming. Fortunately, the Cohen family, fortunate for Tennessee, the Cohen family stayed there, and Steve Cohen, who's an advocate for human rights and for the people of Memphis, is here as a supporter from Tennessee. Thank you. Thank you, Steve.
Thank you, Lloyd. I appreciate the history lesson because Texas wouldn't exist for Tennessee. Tennessee originally was part of North Carolina, so Kathy Manning, thank you. You can take Texas as well. I feel like I'm in Tyler, Texas or Kilgore this morning. I'm here partially because I'm on the Judiciary Committee and I'm on the Crime Subcommittee. This is a crime bill. It is a crime that we haven't insured and given health care to everybody in America. It is a fundamental precept of every moral organization, every religious group that's ever been on this planet. Every group that's supposed to have compassionate basis to it, except for the United States Congress, which maybe isn't supposed to have a compassionate base to it, because half of our colleagues are in the Q caucus, have health care and care about others. If you're a fan of the New Testament, read Matthew. Most of the Q culture in the red states where they don't extend Obamacare, they believe in the New Testament. They skip part of Matthew where it talks about helping people who are sick, healing them. So I'm happy to be here because this is a crime that's been perpetrated on people who live in red states, who are getting sick and who are dying, and that needs to stop.
Thank you, Steve. We've got women here to answer any of the hard questions. I'll take any of the easy ones. Does anyone have a question about our legislation? Sure.
Yeah, I have a question. I'm Maya Goldman from Inside Health Policy. Thank you for holding this press conference today. I'm curious if there are any concerns about state governments retaliating in some way against county governments who do that do this, and if you've built anything into the bill to...
Well, it is true, especially in Texas, we've had such hypocrisy of people asserting state sovereignty and ignoring the rights of local governments on things as trivial as plastic bags and trees. In this bill contemplating that, we include incentives to the states. They get additional money for making their roles available, and we include penalties if they don't cooperate. We don't view this as outraged as we all are that the states haven't done their job. We don't view this as a way to confront the states. We're offering their ideological objection from governors like mine, but at least empower a city like yours to be able to do its job.
Well, all I wanted to say was in terms of dollars, at least for Harris County coverage and hospital system. I mean, that is taxpayer, local, county dollars. And then they get probably, 1/3 of their budget is also federal dollars. So I don't know what big stick they could come up with in terms of withholding any state dollars, because frankly, the state doesn't invest in this area. And that's the problem. We're leaving a lot of dollars on the table. Other states have taken advantage of this. And let's remember that Medicaid's expansion is not just, when you say poor people, it's not just people of color. I mean, I forget the number right now, but we found out that a lot of veterans who have difficulties in navigating the veterans system and some things that the veterans insurance policy doesn't cover, they could get through Medicaid expansion because it would qualify. So it would help veterans, it would help the elderly, it would help so many people across the state. So this is not a rural urban fight. This is not a people of color fight against it's about people who need access to health care. Representative Escobar talked again about the pandemic. A little over 50% of the deaths in Texas were Latino. And it's connected to not having the health insurance. The disparities were there before the pandemic. They're going to be there after the pandemic unless we do something. This is something we can do and do it quickly.
Thank you.
Yes.
Hi, I'm Jessie with Modern Healthcare. Is your proposal or any other proposal that would close this coverage gap going to be in the reconciliation bill?
That's certainly our objective, is to say, in the past reconciliation approach, the approach we took even last summer, was to address the very legitimate concerns of many people in the middle class that the Affordable Care Act needed some additional help to be able to afford the marketplace. Lizzie Fletcher, who was here, worked on a 95% incentive to the states that made it in there. I'm convinced that if you gave Texas $1.50, the ideological objection is such that they would not accept it. So we have targeted this specifically for Medicaid expansion as an alternative that will address the needs of those at the bottom of the income scale, the people that are too poor for those marketplaces. There are several different approaches out there. I'm glad to discuss any of them. I'm not here to diss any. I'm just here to try to find a practical way that we can include in reconciliation that will get this job done. Yep.
Just circling back a little, one, yes, we want to see this in whatever package is moving forward. I will say to the local issue that in Georgia, a lot of counties support publicly funded hospitals, and they add an additional percentage tax to their millage rate to do that. And so having Medicaid, and that's for uncompensated care, and so having Medicaid expansion would help relieve some of that fiscal pressure on our local governments. And people need to realize that in some local areas in our state that they do pay higher taxes because Georgia did not expand Medicaid. And so I think this is just opening one of many possible doors to encourage the state to get more people covered.
Sure, Kathy, and thank you, Carol.
Let me just add one thing. This will not only will this relieve the state burden, it will relieve the burden that our hospital systems are struggling with. We have 3 great hospital systems in my district. All of them have talked to me about the fact that they are struggling because they don't turn people away. They have to take care of people who don't have any health insurance coverage, and they have begged for us to figure out how to take Medicaid expansion. By the way, in my state of North Carolina, the issue is not our governor. We have a great governor in Roy Cooper. The issue is our Republican-controlled state legislature. So I'm thrilled that we are proposing this bill that would help people who have been struggling in my state, that would help our hospital systems, and it would provide the relief that I believe our governor would love to have were it not for our Republican-controlled state legislature.
Thank you. Yes, sir. Have you talked to Energy and Commerce? I understand they may be working on a different approach. How did those?
We sure have. Back on it was the 21st of May, Frank Malone submitted a CBO request for us on this. I've talked with him, I've talked to his staff, I've talked to the Domestic Policy Council, to Secretary Becerra, to Acting Director Young at OMB. Yes, there are a number of other proposals. One of them is to do all this through a federal Medicaid program. Another is to get people into the marketplaces. All of these, just like this proposal, all of these have pros and cons. One of the questions that clearly will be raised is what we do about the states that did the right thing and whether we're giving too much incentive to the states that did the wrong thing. That's why I think this program fits well, but we don't want states canceling their Medicaid programs in order to go into the marketplace. There are also questions if it's an entirely federal Medicaid program about how quickly that can be set up since there isn't a federal Medicaid program. Instead of having a federal program, we try to tie into the state programs. Maybe the biggest question is that of cost. Some of the estimates that I have seen done by groups like the Urban Institute suggest that to get everyone who's eligible covered could cost as much as $400 billion over 10. I would like to think that there is enough heart in the United States Senate to approve $400 billion for poor people in only 14 states, but I'm not so sure. Maybe we can get that done. It would be great if we could get that done, but we just don't want to walk away empty-handed again, and this is a great backup to any of those proposals. Okay, we do have to go vote. Yes, ma'am.
Rachel with Politico. Just real
Sure.
quick, what's your sense of where Pelosi is on wanting to include something on Medicaid expansion in the next?
I'm really encouraged in
package?
visiting with her staff about this, that they're looking at a range of proposals, and you know, we wouldn't have the Affordable Care Act without her. I think now is an opportunity to see that its full promise is achieved. Any others? Thank you all so much for being out here. We really appreciate it. Thank you to my staff for a great job. We're going to run vote and